as I had said earlier, my name is Salim Ali, a founder advisory board member and the coordinator of the Southern region. So we'll get to know what Lightup Impact does. We'll get to know how the regions that we have at Lightup Impact. And we'll also have a chance to interact with the Lightup Impact members. So Lightup Impact, it's a community of more than 150 young visionary grassroots leaders fighting inequalities in gender, health, and education in East Africa. The tagline that we are using as Lightup Impact is shifting the power, and it is a tagline that reflects the programs as well as the operations at Lightup Impact. We are a community of 150 young visionary grassroots leaders, and we empower the leaders to become sustainable and scale their impact through bottom-up approach. The approach that we are using, we provide an enabling environment for sustainable grassroots organizations and their leaders, so as well as their leaders. The 4 items, that is an online community of practice that entails networking and peer-to-peer support, diverse sectors that uses trust-based. We have the skills and capacity development. We have 2 organizations supported in this. Look, that is, we have Usani Village and more in Kenya. Additional capacity building of the Lightup Impact as part of it. Moving forward, we have FAB members representing organizations. In Kenya, we have 3 regions, that is the Western region and the Southern. We also have London region, where we have 25 members. The Rwandan region, the Central region, we have 50. Tanzania. We are looking at the member organizations within these regions for sustainable development. Yeah. For the Western region, we have Roger Somolo and Jacqueline Marwa, Brenda Alwai. Also to mention that the Lightup Impact Kenyan membership regions. So we are happy to inform you that this webinar was organized. Yes.
Salim, sorry for interrupting you, but somehow you're breaking. We can't hear you well.
Yes, I can hear you.
So on our end, you are a bit static. Could you try and see
hear me?
How to adjust that so that you can hear well? Salim? Salim, can you hear us? Try again.
Jacqueline Maro, Brenda Alwai, Salim
Can you hear me?
Lightup Impact.
Try again.
Can you hear me now?
Yes, go on.
Oh, sorry for that. So for the Southern region, we have Roger Somolo and Jacqueline Maro representing the Western region. For the Northern region, we have Brenda Alwai, and for the Southern region, I'm representing. So we are happy to inform you that this webinar was organized by the Southern region members. Yeah. So just an icebreaker. I'd like you to all participate in this. Just share on the chat your name and also share one word that when you hear or when you think about GBV, what comes into your mind? GBV, any name or any word that you can mention representing GBV, because the talk or the webinar is about the 16 days of activism against gender-based violence. So on the chat, kindly write in your name and anything that symbolizes or reflects GBV. Yeah, thank you. So we have pain, abuse. Yeah, let them come in. Yeah, thank you. When you hear about GBV, what comes into your mind? What reflects GBV? Anything? Thank you, thank you. Yes, thank you. Thank you, Fia. Yeah. So all what you're saying reflects GBV. Yeah, keep them coming. Keep them coming. Yeah, thank you. Thank you. Thank you. Yeah. Thank you for participating. So today we are talking about empowering GBV survivors and strengthening community resilience. So we have three speakers: Caroline Wanjiru, Mohammed Musi, and Syonthi Kithembe. They are amazing people, and they are experienced on GBV matters. They are representing different organizations. So we'll start with Carol. Carol is the head of Girls Safety Program, Coast Region, representing Addis Clinic. She is also adept in issues community development and supporting children, young people, young mothers on issues GBV. She'll be taking us through healing and empowerment, addressing the health impacts and GBV, gender-based violence. So, karibu, Carol, and the floor is yours.
Hi, everyone. Thanks, Salim, for that amazing introduction. I hope you all can hear me. Please confirm as I share my screen. Am I audible?
Yes, Carol, you are
Yes, you are audible.
Oh, thanks.
Yes, Carol, you can proceed, kindly.
Yeah. You can see my my presentation, yes?
Yes, you can see your presentation.
So, as I was introduced, my name is Caroline Wanjiru. I'm a clinician and a project lead, and currently working towards becoming a community health specialist. Well, I work for an organization called the Addis Clinic. The Addis Clinic is an international NGO registered in Kenya as well. And I'll just take you through a bit of what we do. At the Addis Clinic, our vision and mission is basically building a future where everyone has access to affordable and high quality healthcare. We know healthcare can be a challenge, especially to underserved and high risk population. So that is why we exist. Our mission is to deploy clinical expertise and digital health solutions in medically underserved areas throughout the world. Our digital solutions go across using telemedicine, using technology to just find ways of connecting healthcare workers with communities that do not have access to healthcare. Our site is www.addisclinic.org. Feel free to visit and check out the rest of our work. We came into existence in 2011. The Addis Clinic, since then, we have provided access to high quality healthcare in some of the world's most challenging healthcare. We've impacted 2.5 million patients in East Africa, the majority being women and children. I remember Salim mentioning that is the area that we, especially I in coastal region, work in. Some of our programs are, we have the mother and child programs in Somalia, the HIV program in Nyanza, and our program in South Coast, which is the Girl Safety Program. So on to our slides. I know time is limited. What we were supposed to talk about today is healing and empowerment, addressing the health impacts of gender-based violence. We live in very interesting times, especially in our country right now, where gender-based violence, femicide, has become such a huge deal. And it is said statistically that GBV affects 1 in every 3 women globally. But currently, if you check the statistics, I think it's even higher than this because of what we're experiencing. Survivors, because of the kind of whichever kind of violence they go through, face profound physical and mental health consequences. So we should have effective intervention that can heal trauma and empower survivors to rebuild their lives. Think of it like this. Imagine someone who has gone to war. When they come back home, they usually struggle to adjust. It is the same thing with a GBV survivor. They have gone through a traumatic experience, and we as a community should take time to support them, provide services, and also help them to be able to reintegrate back into the community. What are some of the health impacts of gender-based violence? Gender-based violence come in different forms. It could be physical, it could be economical, it could be emotional. So these are just some of the impacts. Injuries, broken bones, bruises, burns. This is physical, when you have physical harm. Reproductive health, let's talk about rape. Then you'll have unintended pregnancies. If they do not present to the clinic on time, they will be exposed to STIs and sexual dysfunction. They might also be exposed to chronic conditions like migraines, gastrointestinal disorders, and chronic pain. All these can either be physical or psychological because of the trauma that they have gone through. So today I wanted to base mostly on the mental health impacts of GBV. I know our time is limited, and when we sit down to talk about GBV, it is something that we can discuss the whole day. So I just took time to highlight, especially in mental health, because in general, even in our own country, mental health has not been really put on the front line. We have very few mental health practitioners. We do not have access to them easily. So it is a challenge currently. So imagine it in the setting of a person who has experienced gender-based violence. What are some of the consequences? There are psychological consequences like PTSD. When I say PTSD, I basically mean post-traumatic stress disorder. Remember when I said, think of it like someone who went to war and then came back home. Imagine someone who has gone through a traumatic experience. They usually have post-traumatic stress disorder similar to a person who has been to war. So they'll have anxiety, they'll be nervous, they'll not be able to interact with other people normally. Other things that come with that is also depression. They will have sleep disorders, feeling of shame. because we know in our communities, it is known statistically that the people who commit gender-based violence are usually a person known to you, a person close to you, a person related to you, and that's why we have challenges even in terms of reporting. So imagine having gone through that, and the community is looking down upon you. You will have feelings of shame and self-blame. They will have suicidal ideation, and they might even end up in substance abuse. What are some of the mental health interventions that we need to help our persons with lived disability? One, we need to have informed counseling, trauma-informed counseling and therapy. We need to have peer support groups to rebuild trust and reduce isolation. I have spoken of the fact that most times the person who has committed the sorry, can I continue?
Yes, continue, please.
Okay. Sorry. So I was saying we need to have trauma-informed counseling and therapy. We need to have peer support groups to rebuild and reduce isolation, because we've known reintegrating this person back into the community is a challenge because of the traumatic incident they've gone through. So we need to have support groups where people feel like they are not alone, and so that they're able to be reintegrated back into the community. Community-based mental health services for accessibility. I cannot say this enough. We have very few practitioners. We have issues when it comes to continuity of care, when it comes to mental health services. Where a GBV victim presents to the facility, they usually go through all this. They go to the physical check, they go through a therapy session, but once they're released back to the community, there's that lack of continuity of care. In terms of mental health cannot be healed like in a snap of a finger. It has to be consistent follow-up. So one of the ways we can do is empowering community health providers to be able to provide these services, increase accessibility to the people even once they go back to the community. This is a general slide. Then you will understand the impact. Anyone can have mental health problems, anyone. According to the Task Force report on mental health in Kenya, at least 2 in 10 of outpatients and 4 in 10 of inpatients in different health facilities had a mental disorder. This is somebody who, we are not even looking at people who have gone through a traumatic experience. And an estimated prevalence of psychosis stated at 1% of the general population. People living with lived experience, these are people who have undergone GBV, are at a higher risk of some of these mental health conditions. So imagine those are the numbers for people who have not gone through traumatic experience. So imagine someone who has gone through gender-based violence. It means the chances of them experiencing a mental disorder is even higher. It is important to remember that mental health conditions are treatable, and that people who have mental health problems can recover with the proper care, with the proper support, with the proper follow-up. Mental health people can actually learn. People with mental health diseases, even those ones who have gone through gender-based violence, can actually go back to the community and relearn how to live in the community that they come from. Integrated approach to healing, holistic. This is a holistic care model. So medical care, immediate treatment for physical injuries and reproductive health needs. We know this is accessible in most of our government, not all our government facilities. But the challenge here is sometimes we have a challenge in reporting. So this person might come to the facility late when everything has gone wrong. This person has been exposed to HIV, this person has pregnancy and other STIs. But we need to integrate that into our care. Psychosocial support, trauma-informed therapy, and peer networks. When they come to the facility, they are offered this support, but there's still that gap of continuity of care. I want us to look at the slide as the ideal state and then try and translate it into the communities you come from. All these things we have access to them. When you go to the public facilities, you will get the medical care, you will get the psychosocial support, but there are still challenges, there are still gaps that we need to address. Economic empowerment, especially for women and girls. Emotional abuse, physical abuse sometimes happens because they're not economically empowered. So it is important to empower our women to have a skill, to have a training, so that they can be independent on their own so that they cannot rely on an abuser and not leave that space because of lack of empowerment. Community involvement, address stigma and cultural norms perpetuating GBV. You'll find it very strange that we have communities where GBV has been normalized. We have communities where when GBV happens, they have kangaroo courts. We sit down and discuss and exchange goods and whatever, and then we move on without care for the person who has gone through the violence. So imagine this person going back to live with that uncle, with that father who has abused them, or going around seeing the same person who abused them just walking around. They struggle to readjust. They struggle to live in that community. So it is very important to involve our communities when it comes and sensitize them when it comes to matters GBV. First off, what is GBV? What does it look like? You understand? Because I've realized some of our communities do not know what GBV is. You have a conversation with them and they're like, oh, that's gender-based violence. You understand? So the first step is knowing. I always believe knowledge is power. So once the community understands that there are several levels of GBV, that there is ways of curbing GBVs, that the justice system works for our survivors, then they will be on the forefront to support our survivors. Why your support matters. I'm speaking to everyone in this panel. We come from different spaces. We all have a role to play when it comes to supporting our persons with lived experiences. So we should, one, provide safe spaces. What do I mean by safe spaces? They know that if they pick up the phone and call Caroline and they say, I am going through this and this and this, I will move and make sure they get the right referral pathway and get the help that they need. That if they need a mental health support, I will make sure that they have the support they need and get a healthcare professional attached to them. So we need to support them and create the safe spaces where they are able to get the support they need. Support critical interventions, training, and outreach programs. This is for one, the community health promoters, because we want to increase accessibility. This is two, to the community itself, because we want them to understand the impact of GBV and what GBV looks like, and the importance of reporting and the importance of seeking help. And then three, it is the local leaders, the chiefs and all those. They also need to be part of this. Empowering survivors and building a resilient GBV community. That one has gone through GBV does not mean that they cannot live in the same community, that they cannot cater for themselves. We need to create spaces where they can get empowerment without stigma, without having to be looked down upon like an outcast. We need to create spaces where these people can go and actually be trained and able to cater for themselves, and also be chapters in the community that they come from, so that they can also speak out. I believe that the more we speak out, the more we create awareness, the more people will report these cases, the more people will come out, and the less the people who commit these crimes will have a chance to continue with the crimes. Well, that's all from me. Some numbers here that health lines. You can call them. They're usually toll free. They're for the police, for the child helpline, and for general counseling that is supported by LVCT. It's a toll-free line. You can spread them out in your organization, in your spaces, if somebody needs counseling, especially because we've said there's a gap there. And also on the screen is my email and my telephone number, and also our country director's email and telephone number. Feel free to reach out if you need support, especially in this space or in any space when it comes to delivering healthcare services to underserved communities. Thank you, and I welcome any questions.
So on to our next speaker, who is Mohammed. So Mohammed is a dynamic young professional with over 5 years experience working in humanitarian field, deeply passionate about creating sustainable future. So Mohammed is focused on supporting vulnerable communities on policy advocacy and areas of GBV, peace and security, climate change, and quality education. Over the past years, Mohammed has volunteered and worked in various organizations across Kenya and the broader region, leading and participating in numerous impactful projects. And for this session, Mohammed Mosi, the Director of Solution-Based Organization, will take us through breaking barriers to access care for survivors. Karibu Mohammed, and the floor is yours.
Thank you so much, Mr. Salim, and all audience. I hope everyone is having a very good morning and a very good day. Am I audible enough?
Yes, you are.
Okay, thank you. I hope everyone can see my screen.
Yes, you can proceed, kindly.
Okay. My name is Mohammed Mose. As Salim mentioned, I will be very brief because time is not on our side. Mine is to discuss breaking barriers to access for survivors. As we know, there's a lot of cases and there are a lot of survivors around us, but they really lack, and there's barriers for access to mental health issues and how they can access care. So the first question is why equitable access to care is crucial. As we know, access to care such as medical, psychological, legal, and social support services. It will empower survivors to recover and thrive. Because without equitable access, survivors may remain trapped in cycles of trauma, perpetuating harm across generations. And we have seen this in many cases that people are still going through what happened some years back, and they lack access to care or access to mental health services. So the key reasons for access is healing and recovery. The survivor must access healing and recovery because survivors need timely and comprehensive care to process trauma and regain emotional stability. As we know, many survivors are going through a lot of trauma and emotional instability. So the key reason why people need to access care for or support for support services is to heal and recover. The following one is prevention for further harm. We know if access to care delayed or denied, this can exacerbate physical or psychological issues, which might lead to chronic conditions or re-victimization. The other one or the other matter is restoration of dignity. Access to empathetic, survivor-centered services affirms services humanity. And we are all going there for human rights. So access to this matter is a human right. So we need to restore the dignity of the survivor. So the survivor must access and have survivor-centered services which affirms humanity and help rebuild their self-worth. We also need community impact because one of the reasons and one of the matter is community impact. When survivor heal, the community will benefit from the survivor, which the survivor will contribute the resilience and create a ripple effect of growth and support. So we have key barriers to access. One is stigma. Survivors often face social judgment, like where I came from. Most of the marginalized communities, people, the survivors often face social judgment, internal shame, and systemic bias that normally discourage them from seeking help. For example, a survivor of domestic violence might fear being blamed for the situation or judged as a weak, which will impact us, and the impact will lead fear, which lead of isolation, untreated trauma, and delayed recovery, and the person will lose the person like that, uh, and which we need to overcome. The following one is cultural barriers. We know most of the marginalized communities, they normally face cultural norms and beliefs. Due to cultural norms and belief can limit survivors' access to care by creating mistrust or resistance toward formal system. For example, UNHCR, a source from UNHCR, some refugees family may avoid an example of a refugee family which can avoid seeking mental health support due to stigma within their culture or language barriers. A source from UNHCR in 2022, only 10% of refugee population access cultural competent care, which will impact survivors may excluded from critical services because they do not align with their cultural or linguistic needs. The other one is economic challenges. You know, we are facing economic challenges, all of us, but when it comes to survivors, they are far away than us, those who are not survivors. The high cost of care, lack of insurance, or inability to afford basic transportation, which can prevent survivor from accessing necessary services. Like a single mother, a single parent, working two jobs might not afford a therapy session or have time even to attend them. So, survivors in poverty are often forced to choose between daily survival and seeking help. So, we have to do something on accessing the survivors accessing to services on GBV. We need it to be very accessible in an easy way. There is a source from HRSA which says 60% of rural counties or rural communities lack mental health providers. My last take is to call action for all of us, because the need of equitable access is not just for a survivor issue. It's a community and social responsibility. So by addressing these barriers, we can help survivors heal and empower them to rebuild their lives while strengthening our communities and all the people around us. Thank you so much.
Good morning, everyone. Thank you, Salim, for that introduction. And thank you to everyone for participating and for joining this engagement today. As Salim has said, my name is Syonthi Kithembe. I am the co-founder of GforGirls Initiative, which is a community-based organization in the Kenya-Tanzania border ward called Vanga. We work towards ensuring the access to education for girls and the issues surrounding it that might prevent girls from accessing school. So we address forced child marriage, teenage pregnancy, safeguarding, child protection, scholarship workshops, and training teachers and non-teaching staff on their role in gender transformative learning environments. So I think my presentation is going to be short, but it's also because the two other speakers that have come before me have touched on some of the presentations some of the issues that I would want to touch on in my presentation. And my presentation is going to be talking about support systems for sexual and gender-based violence survivors. But I thought I would expand it to, of course, resources that are available for civil society. This is NGOs, even community leaders, and even individuals that are involved in SGBV, in the SGBV space, because some of the resources that are available are not just for survivors, but also for people who work with survivors. This is not an exhaustive list, a comprehensive list of everything that's available out there, but I am sure in the midst of everyone who's joined this Zoom, there are people whose organizations are at the forefront of fighting SGBV, or people who are also survivors and friends and family of SGBV survivors who know these resources. So if you have any of the resources that I might not touch on, please feel free to share them in the chat box so that everyone else can access them. So the resources that are available for SGBV survivors and organizations working around SGBV, the fight against SGBV, I think I can categorize them into three. There's preventive ones, the ones that avoid the occurrence of the issue. So some of them are touching on cultural, social-cultural perspectives and norms that enable this SGBV to go to be a continuous cycle. And some of them are responsive. This is now when this happens to you, what next? Where do you go from there? And then some of them are remedial, like after the whole, assuming it's a form of abuse. Let's say it's a form of sexual abuse that has happened. You've taken the perpetrator to court, you've been taken to a recovery center, you've been reintegrated back into the society. There's obvious trauma. Maybe the victim is afraid of how the society is going to perceive them. The family and friends, we don't know who the abuser is. Maybe the abuser is a religious leader. The abuser is a parent, is a relative. What happens? So there's some of those resources. And then I've also categorized them into government resources and CSO resources with a couple of examples. So for the government, some of the resources I have identified include, and resources can be people, resources can be groups, committees. So one of them is the technical working groups in the county governments, national governments, Ministry of Sports, Women and Culture. And the reason why I put this as a resource is because when you're doing advocacy for SGBV, even as an organization, you will rely on these technical working groups to get your voice out there, to get your concerns out there. Some of NGO workers and CSO workers sit on these committees, so they are able to articulate some of the issues that we might not able to articulate to policymakers and the government. So this is a resource that is available for NGOs, even for survivors to come and share their stories and their concerns, because they know exactly what they need. We have the safe houses. I remember once we did a training on the Kwale gender prevention, Gender-Based Abuse Prevention Act, and they had a list of some of the safe houses that have been suggested by the government. So I know in each county, there's some that have been suggested. I don't know whether all of them are operational or not, but these are available for victims or survivors and their families that might not feel safe. Even whistleblowers, there are people who report these cases and their life is in danger because they reported these cases. So I know they are kept safe somewhere, although there's been concerns that eventually, especially when the perpetrator is not arrested, that why should the victim or why should the survivor be lifted from their community? Why should they be separated from their community? And it comes with shame, as if they are the ones that did this to themselves. Why should they be isolated from everything that they enjoyed, or like everything that they know and all the community around them, as opposed to the perpetrator, of course, being removed from the society? In police stations, there's the Polycare desk. The Polycare desk is the desk is one of the government interventions to make sure that when you go to report sexual abuse, you would speak to a specific desk. So you don't just speak to any random person that you meet in the police station, but if you go to the Polycare desk, they are able to address those issues. Then we have the gender desk in government hospitals. Sometimes I wonder if these are enough. I don't know how many gender desks are available in how many hospitals. I know, for example, there was one in Kwale County. I know there was one in Kwale Hospital. I don't know if all the hospitals in the county are supposed to have one or they actually have one. And some of the issues that had been raised is that, well, when you go to the hospital to present these issues, sometimes the first people you meet in the hospital like they re-traumatize you by, of course, asking you questions that might allude or might imply that you deserved this. And I remember myself, one time I was in the hospital in campus, and there was a girl that had come to report that she's been assaulted the previous night during a campus event. I think it was a festival, a music thing that was happening. And I remember the lady asking her, Sasa wewe vile ulikuwa umevaa, like the way you were dressed, you think, you are the one that is calling this to yourself. And the lady actually said, I was not dressed the way I look now. I was fully covered to the ground. And so if the first person you go to report to speaks like this, that's a gap. But I know that there's a lot of trainings and capacity buildings, and people are getting the language, and they are actually helping victims when they come to report, survivors when they come to report. In the HIV/AIDS prevention programs, I think I tied it to the gender desk a bit because I know, like, the first help that you get when you get there, you get some pills that help you avoid the contraction of HIV. I think pregnancy also, depending on, I would not want to touch on that so much because I don't think I'm well, but I do know they give you a few things that are going to support you, especially to prevent AIDS, to prevent pregnancy and other infections. Then we have child services. Child services work in child protection. I think everyone who works in the SGBV space has a contact person for the child protection and child services. In the counties, so if you spot an SGBV case that involves a child, you would call them and they would intervene. There's the Child Justice Week, which is an effort by the law courts in Kenya. So they have a Child Justice Week where they provide resources and information on ongoing trends in the justice field, including SGBV developments, like what are the trends, what are the issues to look out for, what is the progress that has been made, or what are the developments in the sector. Some of the examples I provided here, the GBV hotline. It's a free toll line. It's a toll-free hotline, sorry. There's the child helpline, which is 116, and the DCI anonymous reporting. So where you can report some of these cases if you identify them. There's part of also the government effort is community awareness. I know, like, on the 25th of November, the president and the governors, a few of the governors, of the female governors, launched the Safe Homes, Safe Spaces campaign, which is supposed to educate the public on the signs and causes of abuse while highlighting resources available to victims. Maybe a discussion for another day would be, is this sufficient, or how many steps ahead does it take us, or what the people in the SGBV space think this campaign is? But this is a form of community awareness, and even just the government acknowledging. I know in this case they were acknowledging that femicide is happening in Kenya as a form of GBV. So it's just the president launching the campaign is also the president acknowledging that he knows that this issue is ongoing and that the government is working a few things. I don't know whether they are sufficient or everyone feels like they're sufficient, but this is some of the efforts. One of the most resourceful documents out there is the Office of Director of Public Prosecution. There's a booklet that provides the reporting guidelines on SGBV cases. This booklet shows like different cases, what you need when you go to report and how you go to report them. It provides a detailed guide on how to report these cases. And I found it very resourceful, especially for organizations, because it's good. It provides you with even the content to train communities on where to go first and what to do, like do not wash yourself, do not burn your clothes, all those issues that had been raised as part of the reasons why people don't get justice, because they do not provide the evidence that would allow the case to go on. Oh yeah, and then there's different reports from research that help NGOs working in this space. The famous one is the Kenya National Demographic Health Survey, and it provides like data and research from the ground on SGBV issues. And this is important, especially in advocacy and in sometimes when we say that SGBV is ongoing or femicide is ongoing or sexual abuse, child marriage, there's people that say, no, nothing of this sort is happening. So when we have these reports, when we have this research from reputable institutions, we're able to say, well, but the Kenya National Demographic Health Survey held this survey and they said 1, 2, 3, and they provided the numbers. They showed how they conducted their research, so you cannot argue against it. The civil society also provides a few resources. There's legal aid. The first speaker highlighted this when she talked about pro bono services. So you don't have to pay for this legal aid. You just go and present the case, and then they help you pursue justice. And this is also important for strategic litigation. This is when you want to use a case as an advocacy tool for the rest, as a way of setting the tone for how other issues of similar nature are going to be addressed in the country. And it is very good, especially in the legal field, as it sets precedents for everything else that happens thereafter. We have FIDA, this is the Federation of Women Lawyers in Kenya, and they have a hotline where you can call if you identify one of the cases, and they're able to help you. There's some of the organizations that also help with complications in pregnancy. This is maybe a child has been assaulted. They are having, not even a child, just anyone that has been assaulted, and they have complications in pregnancy with the child. So they help you out. If you cannot afford, what is it called? Medical care, especially during the prenatal and postnatal clinic times. We have helplines, child protection and safeguarding. I've talked about FIDA. I've talked about this one is for Kwale County. Human Rights Agenda has a number, and you can see it starts with a hashtag. So if you wanted to, sorry, I should have done this. If you did not have airtime, you can reverse call them and then present your issues. Then we have social media awareness. I know Usikimye does more than social media awareness, but I wanted to highlight it as a way of also amplifying these cases, because sometimes a case happens somewhere in the grassroots and no one is able to know that this case happened. But if you found Usikimye, and because they have a national and they have a very big outreach, then this case is highlighted on a national scale, probably even global. I don't know if global, but even just beyond the national space, and then you're able to get the help that you need. These are also other forms of other resources that are provided by civil society. We have Gender Violence Recovery Center. This one is in Kilimani, in Nairobi Women's Hospital, and it provides free medical treatment and psychological support for all survivors of abuse. For example, for us at G4Girls Initiative, we do handle child protection and safeguarding issues, but we refer them to people who might actually do something about it. And then we have litigation, legal aid, churches and religious centers. I know there's churches and religious centers that provide counseling. They provide support, like they would visit a survivor or the family and friends of survivors, provide them with clothes, with food, with shelter. I did not find specific examples that I can pinpoint, but I've heard of religious centers and churches that do help survivors. Universities and learning institutions, they also provide data, research, think pieces. And this is especially important for organizations that are seeking data for societal change campaigns. And just recently, I think during the process of the 16 days of activism, I did see universities were championing for implementation of sexual harassment policies, that students are being harassed in universities, they're being abused, but the sexual harassment policies are not being implemented effectively. So I saw some demonstration, which means things were not working, but they're pushing for things to happen.
Kithembe, your presentation is down. Kindly share your slides. We can see the slides.
I'm actually done. Done. Yes. I think one of the things I never touched about is also some of the organizations do work around the factors that lead to the abuse. For example, sex tourism, which leads to a lot of abuse, and especially for young underage kids in the coastal regions and in other tourist populated areas, might be caused by, of course, lack of education, economic struggles. And so some organization will provide skills and entrepreneurship training for these girls and give them funding to carry out projects that will take them away from the sex tourism. I think that's it for me. Any questions, concerns?
I would like to thank the speakers as we come to the end of today's sessions. Take this moment to extend a gratitude to Carol from Addis, Mohammed, Muse from Social Base, as well as Ilse Kithembe from GforGirls. Your expertise, insights, and passion for addressing GBV have provided us with deep understanding of the challenges survivors face and the opportunities that we have to support them. Thank you, and we are hoping that you'll be available for any further questions. So participants, kindly share any feedback, response, opinions, or comments, as well as your advice on any topic of discussion that has been mentioned today. And we truly appreciate. And I'm kindly requesting for those who can switch on their cameras to switch on their cameras so that we can take a photo kindly. Announcements. So for the member organizations at Lightup Impact Community, we'll have an end of year Lightup Impact Community meetup. And this will only be attended by the members only. So dated on 11th December 2024, it will be a Zoom Lightup Impact Community meetup. So we are hoping that you'll all join. We'll all share the achievements that we've had over the year, as well as it's a room for us to interact further. And for the rest of us who have not joined the movement, Lightup Impact is open. Kindly reach out to us to discuss collaborations, to join the community at contact us at Lightup Impact Community, lightupImpact.com. And there's a QR code there to scan for any support, because we always have monthly giving programs for any support, so that we support the member organizations as well as the leaders in these organizations. Yeah, so kindly reach out to us, and I'm requesting Chesir to type in that email on the chat. Contact us at lightupImpact.com. Feel free to reach out for any collaborations, any meaningful engagement. We are open. And thank you to our partners, Lightup Impact, for organizing this. To Addis Clinic for having our speaker, Caroline, to the Southern Region member organizations, that is Solution-Based Organization, Communities for Change, Give for Good Kenya, Badili Tana Initiative, Doors of Hope, Click Community Organization, Sema Nami, Path Health Organization, GforGirls Initiative, Kazandani Creative, Girl Kind Kenya, as well as YSD Kilifi County. Thank you all, and I'd like to end it there. May you have a Merry Christmas and a Happy New Year. Thank you. Thank you all. Thank you for joining. Thank you
Salim,
for
just
participating. Yes.
Before we leave, would you please fill in the survey? There's a survey that has been shared.
Yeah, the survey. Have you shared it on?
Yeah, sure.
Yeah. So let's not forget to fill in the survey. It helps us get the feedback that you have on the issues discussed, as well as any place to strengthen. But I'm hoping it has been an amazing conversation. So don't forget to fill in the survey. We'll be happy to get your feedback about this webinar.
Thank you, Salim, for that. It was a good one. We really appreciate